I'm Dr. Karen Harkaway. I practice in New Jersey outside Philadelphia, and I've been using the Vanquish now for over a year and a half. Welcome to our webinar, and I hope you'll find it interesting to learn about this wonderful piece of technology. Of course, any time that you're thinking about buying a new piece of equipment, we have to balance clinical outcomes, expense, science, expectations, consumables, many things. I hope you'll learn during this webinar that Vanquish is an excellent option for many people. Some of the things that can become problematic are inconsistent outcomes and having to explain to patients why they don't look the way you said they were going to look. Of course, there's price point and worrying that you shouldn't have bought that thing that you just bought 3 days ago, buyer's remorse. And the other thing is the ability to cross-sell and profitability. How much are you going to be able to make on this particular piece of machinery? These days, people are much more body conscious. As a matter of fact, in 2014, the ASDS found that 89% of respondents are bothered by excessive weight. So clearly, this is something that we can capitalize on, as well as help our patients. Patients do not want downtime. There's been a tremendous increase in demand for non-invasive procedures as opposed to traditionally invasive procedures such as liposuction. With Vanquish, we can vanquish the core. We can utilize this technique, this non-invasive technique, to reshape their bodies, which is something that 44% of respondents in a recent survey said they were looking for. Vanquish is the world's first non-contact, multipolar, selective radiofrequency treatment to heat deep tissue non-invasively with no downtime. All of these factors are going to be important as you consider what sort of machinery you should look into to achieve body shape. We're going to just look real closely at a couple of results. Here you can see there in 4 weekly sessions, this person has lost 12 centimeters circumferentially. So that's a pretty significant reduction. These are happy patients when they leave. In the next slide, you can see someone losing 7 centimeters. And so since we in this country usually talk to patients about inches, I will tell patients usually anywhere from 2 to 4 inches is what they can expect to lose. So now let's take a look at the science. Vanquish is comprised of multipolar selective radiofrequency. So Thermage, for example, is monopolar, and other things are bipolar. Vanquish is the first thing to be multipolar, so you are getting a real cross-directional utilization of the radiofrequency, and this is what makes this technique so successful. We can think of it like an incandescent light bulb, something which I guess we're not going to be able to use as an analogy anymore in the future. But we can all remember, I believe, here's our light bulb, here are the 2 filaments, and the energy is created in between the 2 filaments. So we can use that analogy, apply it to the skin and the muscle. The skin and the muscle are the 2 filaments, and therefore the energy stays in between those 2 conductors. They stay in the fat that's in between the skin and the muscle. We know that Vanquish penetrates much more deeply than many other non-invasive modalities. We have studies that will show that, but you can see on this slide that we are achieving temperatures of 43 to 45 degrees at 15 millimeters depth. That's important, of course, if we're talking about losing significant volume and not just a little layer of cells that's right underneath the skin surface. Vanquish features the largest spot size of any non-invasive treatment. It's the entire surface of that big applicator. Here's the thermal profile that you can see, and it's the entire abdomen that's being treated at one time. That is one very unique feature about Vanquish compared to other modalities. The next slide talks about impedance matching, which is important to just note that the machine itself will tune into the impedance of the patient's own skin, fat, and muscle. There's a feedback loop. You'll see how the patient is tuning, and what that means is that you're delivering maximal energy back into the patient. The machine creates the actual flow so that it regulates what is being delivered. It is optimized delivery so that any unabsorbed energy gets put back into the patient. So now let's look at some clinical validation. First, we're going to look at an animal study, and this was initially presented in the ASLMS journal in April of 2013. They looked at 3 pigs who were treated 4 times, 30 minutes each at 1-week intervals. And of course, they utilized animals so that they could then biopsy and look and see exactly what was going on. Skin and fat temperatures were measured, monitored, and biopsies were taken. And they even looked at liver and lung samples to make sure that there were no adverse events there. What they saw upon the biopsies was that the fat cells were actually undergoing apoptosis. They were beginning to die as a result of the radiofrequency treatment. You can see in the next slide of the histology, before the treatment you have normal fat cells, and after the 4th treatment you can see denigration of the fat and the beginnings of reabsorption. Also, when they were able to look more closely at the tissue in this slide, which I love, you can see the actual thinning of the fat layer, while you can see an actual normal epidermis, normal hair follicles, so there's no reduction in hair. Though some areas people might like that, but that remains the same. And you can see from the next slide, looking at the ultrasound, that there is a significant decrease in thickness of the subcutaneous tissue by 2.9 millimeters. So in conclusion, we can see that the frequency utilized by Vanquish is best matched to the impedance of fat, at least in guinea pigs, as they utilized here. Now we'll turn to some human studies, first published in the Journal of Drugs and Dermatology in March of 2014. In this study, they looked at 40 healthy men and women and who underwent 4 30-minute Vanquish treatments once a week. They took photographs and they measured. They did not do biopsies. The results showed that there were 35 subjects who completed. 5 were non-responders, but 30 responded well with a mean reduction of 2 inches. Therefore, it was concluded that this was a safe and effective treatment. Patients reported high satisfaction in the questionnaire, and the study was well tolerated, with 90% reporting no pain at all. Another study in the JDD, which will be coming out in June of 2015, looks actually at histologic samples from humans, looking at human apoptosis in the adipocytes. This study looked at 2 healthy female subjects who were treated with radiofrequency for 45 minutes. As you can see from the next slide, the histologic apoptotic index showed an average increase of 487%. That is the difference in which cells were found to be apoptotic before and after treatment. In addition, during the study, the average epidermal temperature was 31.6 degrees, but the internal temperature at 1 centimeter showed continuous, stable temperatures of 45 degrees Celsius, which is what we know is needed to kill fat cells. It was therefore concluded that Vanquish induces an increase in apoptotic index in fat cells 1 hour after radiofrequency treatment, and that this was a safe and effective treatment. But let's look now at some before and afters, because ultimately the proof is in the pudding, and you have to be able to make patients happy, and you have to be able to see that this is worthwhile. So here we are looking now at this initial slide showing a Vanquish after 4 weekly sessions. I believe these initial ones were at 30 minutes, and subsequent practitioners have started to use 45 minutes. Again, the second one showing the flanks just depends upon how you position the patient within, on the table and with the applicator, which areas you're going to treat. So significant love handle improvement is seen for both men and women. The next slide is my own. At 4 treatments, 3 weeks post-treatment, you can see a significant decrease in the abdominal girth. Same thing with this next treatment, getting rid of a muffin top for sure there. I like this next treatment by Dr. Sobel because it does show a bit of a tightening that I think we do see with Vanquish. It's not promoted very much, but certainly in my own practice, that's what I have seen, that the skin not only is that the patient is smaller, but the skin actually looks smoother. And you can see on the lateral view also the significant decrease. This is another slide showing the back, the love handle area. And next again is an abdomen. And here's another one of Dr. Lupo's. Again, a patient with their abdomen being treated, showing not only the volume reduction, but the skin tightening that does occur. And the next slide is a person who's kind of little and yet getting a result. And this patient on there before we might be happy with, but they were not, so they are doing better now. And now we can turn to some new studies showing improvement in legs using our new Flex applicator for the legs. So you can see from this study that the lateral thighs are improved, the medial thighs are somewhat improved. The Flex applicator can go over 2 different areas of the legs at the same time, and that the result persists for at least 2 months. But as I had said, of course, we expect that this will last indefinitely. And now we'll turn to a question that is very important for anybody looking to make a purchase. What would be our return on investment? Very important to take the business practice of this into consideration, of course. And here's where it's not always better to give than to receive. Sometimes you don't want to keep giving back to these laser companies. You want to give your initial purchase and that's it. And that's what's really wonderful about Vanquish. There are no consumables. Once you've made your initial payment, that's it. Cool sculpting, for example, has a significant consumable expense ongoing. So from treatment to transformation, as this slide shows, utilizing 15 treatments a month for an average of 12 months, you're spending $184,000 in consumables. With Vanquish, you can give the same amount of treatments, the same treatment, although I would argue that, frankly, you're going to get a better treatment with Vanquish, but just purely in terms of consumables, you're spending nothing. And in terms of profit per hour, you can see this slide shows, making all these assumptions that you're going to charge $3,000 for 4 treatments, et cetera, but I think these are pretty standard cost charges here, that the profit per hour for Vanquish is $850. Surpassing lasers, fillers, Botox, and certainly surpassing Cool Sculpt. Add that to the fact that you are not the one doing the treatment. That's in addition to me sitting there doing filler, doing Botox. So that is a significant profit per hour. And then the cost of ownership, you can see here, breaks it down. The cash flow, it is, I think, a very reasonable price for this wonderful technology. So in summary, BTL is a well-established company that is very responsive to our needs, both on a clinical and in a service perspective. We have very good technology that is scientifically and clinically shown to be extremely effective with very, very happy and satisfied customers. Thank you very much. I hope this seminar was helpful to you.